It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, as I said many times, November 6th is probably one of the most important days of your lives. It's Election Day, and it's very important that you know all about the candidates. I've been preaching here for last year as learning to know the qualifications and what you're going to expect after November 6th. First, before I go on with the show, I want to welcome all the people in Harrisburg area watching the show, as well as on Comcast and on Service Electric Cablevision. Thanks for joining us. And remember, folks, if you want to see this show or if you want anyone to see it, you go to our website at ssptv.com. Just click on the Sam Lesante Show. Folks, as you know, I had Dr. Greco on the show, and he talked about Medicare. And basically what he said was he actually took it from the actual bill. We had a tremendous response from that show, tremendous response. People calling, emails, the good doctor received a lot of calls, but we also got calls and people who were strong Obama people, and rightly so. They said, where is he getting his facts from, and where is he getting his facts from? In fact, I was told the very next day after the show aired that there was an article in the newspaper refuting what Dr. Greco said, indicating that they weren't facts. So today, folks, I figured let's review some of those important things, particularly, folks, senior citizens, as well as all of you who are concerned about health care. But to add a little bit more credibility, okay, not that he's not credible, but we have U.S. Congressman Barletta here from the 11th United States Congressional District to talk about the particular bill itself. So without further ado, Doctor, thanks for coming back on the show.
Well, thank you, Sam. It's always a pleasure to be here. You know that.
Congressman, it's always nice to see you.
Thanks, Sam. Nice to see you again, too.
Okay, Vic, the last time, you talked about Medicare, okay? And what I'd like for you to do, I know this is redundant to a degree, but I'd like for you to restate some of the things from the actual bill, and then I'd like to get a comment from our congressman.
Well, I think we're talking about Obamacare. I tried to point out the facts that what we're doing is rapidly engulfing socialized medicine. And what's going to happen, and I try to explain to all the people out there, you can't give things away for nothing. There's a cost to it. And if people think they're going to get free care from Obamacare, they're badly mistaken. There's a price to be paid for it. And I'm trying to point out that what's going to happen is they're going to be rationing care. They're going to stop giving care, especially to senior citizens after a certain age, certain conditions. You're not going to be treated for. Joint replacements will be a time limit as far as age is concerned. It's already, we were talking about this earlier, it's been estimated that Obamacare and Medicare is going to cost the senior citizens and people in it anywhere from $150 to a price of somewhere around $600.
And the actual premium is $2,400
Right.
increase.
That's an increase that they're going to be paying. And plus the fact I tried to point out there aren't going to be enough physicians to take care of the people because there's 60 million people coming in. We need another 110,000 physicians, which you're not going to have. All I am saying is some people have a tendency when they open their mouth, they lie. And we've been sold a bill of goods on Obamacare. And I'm just trying to warn the people out there, you can't get anything for nothing. It's going to affect your health. You're going to be denied care. Care is going to be rationed. It's as simple as that. We're also going to be finding out, and the good congressman and I had a short discussion about this earlier on, with the cut taking money away from Medicare, I think you mentioned
$716 billion.
$16 billion. And it's been projected that 15% of the hospitals, especially in rural areas, will be closed because they're not going to be able to stay open because of the decrease in reimbursement. Also, there's going to be a tremendous cut in Obamacare and Medicare patients to physicians. So much so that it's been predicted that about 30% of physicians will stop accepting Medicare patients, and a certain number of them are going to leave, period. I also pointed out that primary care will be given to the general public by physician assistant and by the registered nurse practitioner. You will not see a physician for the first few visits or you're going in for primary care. And you know, I just don't want you being sold a bill of goods. And if I may, Sam, before we go any further, for those people who want to know more about this, you can look it up. The bill is SB 3200, and I'll give you page numbers and line numbers where you can look it up in the bill. Page 50, Section 152. Page 58 and 59. Page 65, Section 164. Page 203, line 14 and 15. Also pages 58 and 59. I can continue to go right on down and give you documentation of where all of these things we're talking about are present in the bill. In order to back up what I was looking at, I decided to do an internet search. And I found that there was a judge in Texas. His name was Kidhill, Judge Kidhill from Texas, who reviewed the entire bill and came up with exactly the same thing we're talking about. So he verified what we're saying. I have nothing to gain. I'm out of practice. I'm not practicing medicine anymore, but I'm still interested in my patients. I'm interested in my fellow citizens. I'm interested in nobody being sold a bill of goods. And I tried to tell you, everything that was good they gave you up front. I've heard people say, yes, but our children are covered till age 26 to 27. Pre-existing conditions are covered. This is all the stuff you're putting up front to make you feel, boy, I'm getting all this for nothing. Then wham, am I right? The hammer is going to come down, and we're going to be paying through our teeth.
Congressman, what he said, we had a tremendous response, and I guess a lot of Obama people get very nervous, especially when you start talking facts. And it seems that facts are terrible things, but they're factual. When the bill was passed, I think Congressman Pelosi said that she didn't even read the bill. We'll find out what it's about after it's passed. To me, that's, it's just unbelievable. But your comments on what Vic said.
Well, first of all, Dr. Greco is 100% correct, and Speaker Pelosi at the time said that we need to pass it to find out what's in it, and now we're starting to find out what's in it. Obamacare is so expensive, Sam, that they must take $716 billion out of Medicare to help pay for Obamacare. Now, where's that money going to come out of? It's going to come out of reimbursements to hospitals, reimbursements to docs, which is where the rationing of care comes into place, because doctors are not going to see senior citizens on Medicare because of the reimbursements, and same with the hospitals. It also, which we haven't talked about today, puts 15 bureaucrats in between you, the patient, and your doctor. 15 unelected bureaucrats who will be appointed by the president and his staff, who will make decisions on your health care. There's no appeal process. There's no way to get around it. There are 21 new taxes, 13,000 pages of new regulations, and CBO, which is a bipartisan Congressional Budget Office in Washington, estimates that 800,000 Americans will lose their jobs because of Obamacare. This is not the way we want to go. Talking about allowing our children to stay on till the age of 26, there's bipartisan support for that. We can pass a bill to make sure that happens. We can also make sure that pre-existing conditions are covered by having high-risk polls. There's a way that we can make health care affordable without having the government taking it over.
Go ahead,
I
Vic.
think it's interesting, you talked about the committee. And I had mentioned this, and I got a lot of poo-pooing about this, that they won't do that. And of course, as I explained on the program, there is no oversight. The Congress can't stop them. Supreme Court can't stop them. Nobody can stop them. They make the decisions. And the amazing part is, there's a professor down at the University of Pennsylvania. Mm-hmm. You probably heard a guy. I wrote his name down here so I wouldn't, with Dr. Emanuel. He's a bioethicist at the University of Pennsylvania, the most liberal, communistic, socialistic-leaning individual. And he's already been mentioned that he's going to be one of the appointments that Obama, if he's reelected, is going to put on that committee. We can also already see what's happening. It used to be the standard of care when you got over 30, 35 years of age, you got a PSA. Now they're saying, you don't need PSAs. They used to say when a woman reached their age of 30, 35, get mammograms. They're trying to stop the mammograms, only 4 or 5 years. Colonoscopies, which help to bring the death rate down of colon cancers. If you had a polyp, they repeated it in a year for 2 years, then after that, every 5 years. Now they're talking about the fact if they don't, after the polyp's been removed and there's nothing more, you don't have to go back for 10 years. Not only denying care, but they're endangering the health of the patient that's involved in this. But they have to do that to save money and ration care. Now, if I want to get cynical, I've never said this before, but it hit me right between the eyes when I was at a meeting, when they're discussing health care and Obamacare and Medicare. And at that time, they're talking about rationing care. One of these liberal bleeding hearts got up and says, well, you know, if we stop and have a cutoff time for the age when we stop treating a lot of these diseases, we will solve 2 problems. Now get this, 2 problems. The 2 problems, one is, if they die off, we have less medical expense to be concerned about. And secondly, look all the money we'll save on Social Security. Now that's the thinking of some of these people. Willing to sacrifice, you senior citizens, including me, I'm 85, so I'm a senior citizen, willing to sacrifice our well-being to bring across a program that is BS. The Congressman hit it right on the head. But bipartisan support, they can give us excellent medical care, they can do it more reasonably, but you people out there must realize there is a cost related to it.
And Sam, let me just say, in American history, there has never been a bill of this magnitude that has ever been passed by one party. This is the first time in American history that a bill such as this has been passed without bipartisan support, rammed down the throats of the American people. It's clear businesses are going to drop their health care coverage because it'll be cheaper for them to pay the tax than it will to cover individuals with health insurance.
Isn't it also true, Congressman, that a lot of business now are talking about the fact that if Obama gets reelected and Obamacare comes into being, that they're going to cut their staff, mostly part-time employers.
That's right.
Or workers, because you don't have to insure a part-time worker. So what'll happen is you're going to have a lot of businesses throw people out of work, making the unemployment problem even worse.
Folks, you're watching the Sam Lesante Show. I said to you in the beginning of the show that this is a very, very critical election. And once again, we have a U.S. Congressman here. We have Dr. Victor Greco. We're dealing with facts here, folks. And I know a lot of you senior citizens are scared and you're concerned. That's why we're bringing these facts. When I come back, I want to talk to the Congressman about the scare tactics, all right? We mentioned this again on one of the shows I did with the Congressman, that it seems that they're pointing the fingers at the Republicans. They want to do away with Medicare, or take you Medicare, or cost you a lot of money. And 90% of those commercials you're seeing are lies. Dr. Greco said something interesting. He said every time Obama opens his mouth, he lies. Let me tell you one thing that happened, folks, and how we're being misled. When this happened at the debate, President Obama said, when Governor Romney says that we should eliminate funding for Planned Parenthood, there are millions of women all across the country who rely on Planned Parenthood for not just contraceptive care, they rely on it for mammograms. Well, Planned Parenthood, thousands of calls came into Planned Parenthood about mammograms, and they said basically, Planned Parenthood does not actually provide women with mammograms, but refers patients out to the other facilities for the exam. Romney wants to do away with this, okay? Once again, this is what the president said and the actual facts. Let me give you another example, folks, about Planned Parenthood and why yours truly is so against them. And I've always welcomed the opposite side, as I said, that not one Planned Parenthood person has ever come on the show, and I personally invite them. Woman has 3-4 daughters, goes to Planned Parenthood. This is on recording. Goes to Planned Parenthood and says, I think 3 or 4 daughters, and I'm pregnant again, and I don't want a girl. The girl from Planned Parenthood said to her this, well, let's find out what if it's a girl, and once it's a girl, we'll get rid of it. We'll get rid of it. You talk about a society that is going down the tubes fast, folks, and they're pro-abortion, they're pro-partial birth abortion, for everything that is morally wrong, they're for it. The Democrats' platform, not all Democrats are for it. You're looking at 2 here that are conservative Democrats. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. 24/7 SSPTV.com. I'm talking to Dr. Victor Greco and U.S. Congressman Lou Barletta. talking about how very important this election is. Just so you know, folks, I have called Mr. Stelp at least 6 or 7 times, spoke to him a number of times, also emailed him a number of times and invited him to come on the show. He said he was coming on the show, but I have not heard from him as of yet, but he did get an invitation from me. Congressman, what they're saying is this. It seems like the blame game is always there, and the Obama people who are telling people to vote for Obama are saying, listen, the president could have done a lot of things. It's the Congress. We had the Republican Congress, and you guys are the fault of this, okay? And are you the fault of it?
Well, Sam, let's not forget that in the first 2 years of this president's term, he had control of both the House, the Senate, and the White House. This president could have passed any bill he wanted to. Instead of working to put Americans back to work and working on the economy when unemployment was well over 8%, the president was working on a health care bill that nobody wanted. So, the facts are the president had free range to pass any bill he wanted to, but he chose not to. Sam, 89 new freshmen were sent to Congress in this last election. We have done our job. We have tackled every tough issue. We've taken every tough vote to put this country back on the right track and to prevent this president from totally destroying our economy. The president's policies are not working. We've passed over 1,500 bills in the House. We've passed a budget. The Senate Democrats have not passed a budget in 4 years. And the president's own budget is so laughable, Sam, that it couldn't get one vote. Not one vote. Nancy Pelosi couldn't even vote for the president's budget. That's how unrealistic it was. We've sent 39 jobs bills to the Senate that would put Americans back to work from the House, and Harry Reid won't even bring them up for a vote. He puts them in his desk, and they don't even vote on them. We've done our job. It's time that the Senate does, and I believe the American people have a right to have a Congress that is working together to try to put Americans back to work. These policies aren't working, Sam. 24 million Americans out of work. 1 in 6 Americans are now on food stamps. That's up 40% since this president took office. And 49% of Americans are now either classified as low income or living in poverty. These policies are taking this country, taking a bad economy and making it worse.
When you're going around, you have a different district right now, and you've been very active going around campaigning as well as your opponent. What are the people that when you're knocking on these doors and you're in their homes and they're talking to you, especially I always say when you're in a person's home, they'll tell you exactly what it is because they feel more comfortable in their own home. What are they saying to you as a U.S. Congressman?
Well, they're telling you that they want jobs. They're worried about their economy. They're worried about their children and their children's future. Sam, 50% of college students can't find a job when they come out of college. They're finding jobs in anywhere they can, nothing to do with their degrees, and parents are finding it harder and harder to even send their children to college. They're worried about our future, and they want America back on the right track. Instead, we're seeing an administration that is growing the size of government, expanding federal employees when more and more private sector people are losing their job. We're adding more and more public employees. This is the wrong direction for this country to go in, and 4 more years will only take us down to a road, Sam, that I don't believe we're going to be able to get off of.
So the question that I always have is, and when I'm hearing the broadcasters on ABC News and CBS and NBC who are in Obama's pocket, and it's sad. It's already, you heard yesterday morning, Vic and Lou, you heard ABC already has an exclusive interview with the president, and NBC will be, and the hype will start coming. You'll see how the liberals will start coming out and making this guy look like he's doing everything right. Well, I'd like to see one of the things he's doing right. The other thing is this. Where's the Senate here? I mean, we vote a person for 6 years in the Senate. We vote Congress for 2 years, okay? Where's the Senate? Why is it always they say Congress? And like you said, for 2 years, he had total control of everything. So why do they keep coming back to the Congress?
Well,
the congressional.
Because the American people aren't always told the truth. And the truth is that in the House, we're doing our job. But the fact of the matter is that we have a Senate that hasn't even passed a budget, haven't even introduced a budget in 4 years. That's a fundamental act that every Congress can do. Why shouldn't Washington act the same way than moms and pops and businesses all around the country have to act? We expect our government to be doing its job, and the Senate hasn't. And the truth is the fact that the Senate is just not taking up the bills and passing any laws.
May I inject something? That's to do with Obamacare. Did any of you see that John Stossel piece that was done?
Yes.
No.
This, I think, capsulizes what Obama's been doing in his liberal group. They keep broadcasting, and along with ABC, NBC, and all the liberal press, that they're doing everything to try to get people to work. And one of the things that they've been touting is that there are offices where you can go in and they'll help you get a job. So Stossel said, I was too busy to do it, so I'm an intern out. So this young lady goes out, she goes into the first office, and she says, I'd like to apply for a job. And he said, what are your qualifications? So she began to tell him, the lady said, well, you're not qualified, but I get you food stamps. Wanted to sign her for food stamps immediately. And of course, she walked out. Then she went to another office in the same town. I think this was New York City. I forget the exact city, but it was a large city. Went to another one. And she said, I'd like you to help me get a job. So again, she goes to her resume, and they says, oh, are you sure you don't have a sore back? Are you sure you have a depression, something of that sort? We get you on disability. You don't have to worry about working. Now, these are supposed to be the citadels where citizens can go to try to get a job. Obama and his people are touting what they're doing, and what they're doing is pulling everybody in either disability or food stamps. Then she finally went to a place which was supposed to be the epitome of being able to help you. It took her 3 visits, 3 separate visits, before she sat down with somebody that tried to help. This is how you're helping the unemployed? We are running into socialism. We are running into a socialistic dictator. And if that's you people want out there, fine, but realize what you're doing.
Now, the president just issued a policy where to stay on welfare, you can ask for a waiver, a state can get a waiver, that you no longer have to look for work, actually go look for a job to stay on welfare. You can now say, I've read a book, and that will be equivalent to looking for a job to stay on welfare. Sam, the best way to help people out of poverty is to get them a job, is not to keep people down. We are enslaving Americans by keeping them on welfare rather than giving them an opportunity to lift themselves up and have a better life for themselves.
Very well said.
What amazes me is the fact that you have people who are running for Congress or different offices who totally support Obama and his Obamacare. After you see all these facts, and to me, I just understand it. When it comes to special interest groups, I know everyone's concerned about their own, bailiwick, but how devastating could that be, Vic, when you have a person who is, let's say I know it's going to benefit me, just one particular part, if Obama gets in there, not worrying about senior citizens or anything else, but I know, is going to benefit me. How selfish could that be? I mean, what would you tell a person like that?
Well, I tell a person to wake up, realize reality, get out and get a job, and do the best you can.
These are people that have jobs. These are people that are, that have, if he's elected, he's going to put more, let's say 100,000 more teachers, and he's going to do this and he's going to do that. So you have some union people who are heads, not necessarily members, that may feel that, this is why. They're not realizing it's going to hurt their mother, their father, or whatever.
Well, I think the thing you have to realize, and the Congressman pointed this out very well, just to support Obamacare, you're going to start losing a lot of jobs. So though you have a job now, doesn't mean it's going to continue. If you think unemployment is bad now, wait to see what the future holds in. As I pointed out, if Obamacare continues, employers only have part-time employees. How can you live on a part-time salary? People have to think to the future. The unfortunate part is we've raised 2 generations of people who think they're entitled. And I'll never forget the story I read a long time ago, which I repeated, excuse me for repeating it one more time, about the diplomat that came here in America back in the late 1700s, early 1800s to find out what democracy was all about. And when he went back and reported to his governing body, he said, democracy is one of the best institutions I have seen. It works well. He said, however, once the people find out that they can vote themselves benefits and stay home while other people work to do it, democracy will collapse. And that will happen in 250 years, and that's where we are.
The question to you, Congressman Barletta, is before you ran, we got about 2 minutes left, you stated you wanted to do certain things in Congress, okay? Just to reiterate, so the voters would know, what did you say you were going to do and what did you do?
Well, Sam, I was a small businessman before I went to Congress, and it's very clear that we need to remove the uncertainty that's holding back the private sector. I believe in the free enterprise and the private sector. This country won't be saved by Uncle Sam. It'll be saved by moms and pops all across America, entrepreneurs, that entrepreneurial spirit that made America great. That's what I voted to do, to remove the uncertainty. We do not want the government taking over America's health care. We need to remove some of the red tape and get the foot off the throat of American businesses so that we can hire again. And that's what I've been doing, and I'm going to continue to do that regardless of who the president is and regardless of who's in the Senate. That's what the people sent me to Washington to do, and that's exactly what I'm doing.
Doctor, I want to thank you for coming on the show, and the Congressman, is always nice to see you. And folks, when I asked the Congressman to come on the show, he's always here. And I did ask Mr. Stelp 5 or 6 times to come on the show to voice his concern. November 6th is a very important election, folks, very important. It's going to affect your life for many, many years. Please check all the qualifications. Dr. Greco is giving you facts. You can Google it. You can look at the bill. You will see it for yourself. Seniors, beware. Don't be misled. Don't be misled. SSPTV.com, 24/7. You can watch the show anywhere in the world. My email is sam@ssptv.com. Thanks for joining us. We'll see you next time.